In this video, we'll be addressing the fantastic viewer questions that we got based on the previous video, looking at why patients with COVID-19 develop renal impairment. The first of these questions was, what proportion of those in intensive care with COVID-19 develop acute kidney injury? Well, this is a really difficult question to answer because actually most patients who get critically unwell develop some degree of kidney damage. That's because the kidneys are exquisitely sensitive to any kind of disease, and if you don't have enough blood flowing to the kidneys with conditions like shock, or if you've got lots of inflammation, they can all affect the way the kidney works and therefore cause some degree of kidney impairment. We do, however, have some evidence looking at what proportion of patients with COVID-19 require renal replacement therapy, i.e. their kidneys are so bad that they need to go onto a dialysis machine to support them whilst they get better. And the best data that we have is the ICNARC data. This is a national audit of all the patients who come to intensive care, and it's been running way before COVID-19 was a thing. However, in COVID-19 we've got a really robust set of data looking at those patients who come to intensive care and those that need subsequent renal replacement therapy, i.e. being put on a dialysis machine. And you can see here that about 2,000 patients require renal replacement therapy, i.e. need to be put on a dialysis machine. And about 6,000 patients don't require any renal replacement therapy or renal support. So roughly about a third of patients who come to intensive care are needing additional support for their kidneys in the form of a kidney machine, i.e. a dialysis machine. The next question is a really reasonable one, which is, if SARS-CoV-2 primarily comes into the body through the lungs, how is it that it then affects the kidneys? Well, it's a really good question because I don't think there's a simple answer to it. It's worth thinking about the virus itself. What normally happens is that you breathe it in, it then attaches to the ACE2 receptors on lung cells. The virus then gets absorbed into the cell, and then it replicates within the cell, and then the cell releases all of those additional viruses which it's produced. Those viruses then make their way into the bloodstream and then flow all the way around the body. One of the stops will be the kidneys. And you can see that here. All of the body is interlinked by the blood vessels. So part of how the SARS-CoV-2 virus affects the kidneys is that it replicates in the lungs, which is why it takes about 2 weeks before you start to become systemically unwell with the disease, because it's replicating in the lungs, and then once you've got enough of a viral burden in the rest of the body, then the rest of the body starts to become unwell as well. And this virus, we know, also affects kidneys because the kidney cells themselves have the same ACE2 receptor, and that's the receptor that the virus uses to move into the cell and therefore to start replicating. So part of the answer is the virus itself damages the kidney. However, that's not the whole story. With any kind of inflammation where you've got virus or bacteria that causes an immune response, that immune response will create antibodies. Now, what can happen with those antibodies is that they can deposit in certain areas of the body. The kidneys, we know, act like a filter, a sieve. So it'll sieve out all of the stuff. And part of what it can sieve out are the antigens and the antibodies. And they can sit in the space around the Bowman's capsule. And because the antigen and the antibody will cause inflammation, it'll start to inflame the kidneys and therefore cause progressive kidney damage. And you can see this in the schematic diagram here, where you can see there's immune complexes developing within the space of the glomerular capillary. And therefore you can imagine there's going to be lots of inflammation around there. And so the kidneys themselves become inflamed and start not to function so well. So the answer to the question is partly the virus directly causes damage to the kidneys, but also The immune response itself can cause damage to the kidneys by deposition of these immune complexes and subsequent inflammation. It leads on really nicely to the next question, which is, well, how do you treat this intrinsic renal failure or this glomerulonephritis? Glomerulonephritis essentially meaning inflammation of the units of the kidney, the glomeruli. Think back to what the underlying problem is. Now, sometimes the damage to the kidneys is so bad, there's so much immune complex deposition and there's so much virus inside the kidney cells themselves that the kidneys just stop working altogether. And in those cases, what we need to do is to replace the kidneys, and that's where the dialysis machines or the renal replacement machines come into play. And what we do is we filter the blood out using these machines, and so we give the kidneys a rest. So by just giving the kidneys a bit of rest and removing some of those immune complexes through the filter, we can then reduce some of the burden on the kidneys and therefore allow it to recover. So part of the answer is to put patients on kidney machines and give the kidneys a rest. A really important part of the kidneys is just to flush things out. They work as sieves. And so the kidneys are very sensitive if there's not enough fluid in the body because they can't wash everything out. Everything stagnates within the kidneys. So part of the therapy within renal failure is to make sure patients are adequately hydrated. So we do need to give them enough fluid to allow the kidneys to flush themselves out and therefore to recover some function. Obviously, you can't pour loads of fluids into patients because if you imagine that the lungs are really inflamed, you can imagine lots of that fluid then leaking out into the lungs and making the lung function worse. So it's a real balance here, but you must make sure that patients are adequately hydrated. And so IV fluids are important in the management of acute kidney injury. Now, we mentioned that part of the problem is the virus itself. So theoretically, giving antiviral medications that reduce the replication of the virus may well help the kidneys because then it just stops as much of the virus replicating in kidney cells and therefore stopping the kidney cells from doing their normal function. We can also think about trying to reduce the amount of inflammation in the body. And so by giving things like steroids, when you have those immune complexes depositing in the glomerulonephric space, by giving anti-inflammatories, there's less of an inflammatory response and therefore less damage to the kidney function itself and to the kidney cells. Both of these are really important. And honestly, it's probably a combination of both that will be needed in managing patients with kidney dysfunction in diseases such as COVID-19 related renal failure. And probably the most important thing is just giving time, allowing the kidneys to recover. The body's really amazing. It'll recover from most insults, and the kidneys are no different. If you give the kidneys enough time, they will start to regain some of their function. They may never go back to normal, but they may be able to recover enough function for you to be able to lead a normal life. And so by using IV fluids, steroids, antivirals, and renal replacement machines, we can just buy enough time so that the body can clear the virus and then the kidneys can slowly recover. The final point was people were asking, well, these patients come in with viral infections. Well, why do we then look for bacterial infections? This patient's got a viral infection. Well, it's a good question, and one that's required a lot of research over the years in intensive care. And the answer's probably quite complicated, but there's a few things that could contribute to the risk of patients developing secondary bacterial infections from their initial viral one. One of the theories is a theory of gut translocation. You and I know that the gut is full of bacteria. That's why if sort of food gets contaminated with feces, people can get really bad bacterial infections. It's because there's lots of bacteria in the gut. The bacteria in the gut are actually really helpful because they break down different nutrients and help to break down all of the waste products of food. However, if those bacteria then get their way into the bloodstream, they can cause quite significant sepsis. Now, when you have inflammation, your whole body is inflamed. you can see that the blood vessels themselves become really leaky. They become open so that white cells can move out of the blood cells and into the tissues that are infected. But that leakiness is a two-way street. And you can imagine how the blood vessels in the gut, if they become leaky, yes, white cells may be able to move out of the blood cells into the tissue, but bacteria could potentially then move from the gut lumen into the blood vessels and therefore then make its way into the blood system. And if you remember from that slide before, the whole body is interconnected by the blood supply, by blood vessels. So you can imagine how bacteria that move from the gut into the bloodstream can then move all the way around the body and cause secondary infections. So one of the reasons why patients are probably getting quite unwell with secondary bacterial infections is because of the breakdown of the gut-blood barrier. Also, with things like pneumonia, even if it's a viral pneumonia, what you get is inflammation and lots of fluid sitting in the sacs of the alveoli. Now, if you imagine the alveoli, there's a nice fluid sitting in a really warm, moist environment. That's perfect for bacteria to then grow. And so that's exactly what happens. Patients initially come in with a viral infection, the alveoli fill up with inflammatory fluid, and then you get secondary bacterial infections because you've basically got a really nice environment for bacteria to grow. And therefore, patients can get secondary bacterial infections. Now, if you just treat for a viral infection and forget about the bacterial potential secondary infections, patients can get really unwell very quickly because bacterial infections need antibiotics to get them better. So this is why we always search for bacterial infections, even if we've got a diagnosis of a viral infection, in patients who are critically unwell. And that's the important thing. This is in patients who are very, very unwell. Your normal patient in a GP practice out in the community with a bit of a cold or the flu, usually they don't get bacterial infections because their immune system isn't compromised, because they're not critically unwell. In intensive care, because they're so unwell, their whole body doesn't function properly, and that's why their risk of developing secondary bacterial infections increases quite significantly. We've covered some of the questions that we got sent. Please, if you've got more questions, leave them in the comments section below and we'll try and address them. Some of the questions that you sent through will be answered in a lot more detail in the next lecture that we'll be giving, and that's looking at how renal replacement therapy works and how we do it in intensive care.